is Mike Watts. I'm one of the interventional radiologists with AMI Vascular Institute. Wanted to let you guys know we're here in 602 West Sherman. This is our brand new center. It's been open for about a month, and we're here full time to see your vascular patients. I'm going to give you a little bit of a tour, show you a couple different parts, and talk about what we do, and hopefully see some new things. So the real kind of heart and soul of the Institute here is our consultation side. We have 6 rooms, this is one of them, for consults. One of them has full-time RVT, ultrasound tech, who will be doing arterial duplex examinations, ABIs, pressures, as well as venous insufficiency tests. So we have the full gambit of vascular ultrasound available here at all times. So the patients will come in, they'll be led to one of the rooms, seen by one of our staff. Every patient gets ABIs done routinely as a screening test when they come in. Any wounds that they have, ulcerations, photos are taken, uploaded up to the medical record, and we keep those kind of in a longitudinal fashion. So we can see, or you can see, your patient's wounds healing pre and post procedure, and how that goes. That can augment some of your wound care and the photos that you may see, or how often you see the patients in between time. So the patients, once they're part of our clinic, they stay with us. So as far as their vascular issues are concerned, we can take that over, and we do that on a patient-by-patient basis. Every patient comes in, gets evaluated. We can order whatever imaging tests we feel is most helpful. We get the imaging test done here and then follow up with the patient. If they need a procedure, that gets scheduled. If they don't, we'll manage them clinically. And after the procedure, we'll continue the longitudinal follow-up. So what that may mean is if someone has an arterial ulcer, they may need duplex ultrasound, CTA as far as a CAT scan, MR imaging, whatever it is, for us to do the procedure. Do the procedure here on the procedural side, and then see the patient usually 2 weeks later. That's when we do an ultrasound to assess the results, look for early recoil, make sure that the intervention that we performed is durable, and the patient's going to continue to have a good outcome. See him 2 weeks later as a wound check, make sure the patient's doing well. Any swelling that they may have developed has gotten better. Whatever the case may be, that they're doing okay, and then we'll see him again 2 months after that, and then 3 months after that, to make sure that everything's going in the right direction, to make sure that our intervention did what we hoped that it would do, and to make sure they don't need anything else. After the intervention, or even without an intervention, we'll start patients on the medications they need. A lot of times the primary doc sends us patients and they're absolutely optimized with what they need. So whether it's statins to improve their long-term limb salvage rates, or hypertensives managed, or antiplatelets have been managed. Sometimes they're not, and sometimes we start them on that ourselves, and we manage that. So there's certain vascular patients who we know the data, the COMPASS trial, things that say, hey, look, maybe this patient is going to benefit from low-dose aspirin and low-dose Xarelto, right? So we can manage that. You don't need to manage that. We take care of that longitudinally. We deal with that. And as far as that, the medications go, the follow-ups, we collaborate with you. So after every patient interaction, there's a note that's automatically faxed to you and to any other physicians that's taking care of the patient. And then we're available 24/7. So there's always a physician on call, ready to answer the phone for the patients if they have an issue, for you guys if you have an issue. So that's really kind of how we run our clinical service. And for the time I spend here, greater than 60%, probably close to 70%, is clinically in these rooms with these patients, seeing them initially, seeing them follow-ups. The procedural part is a key part, but it's only part of what we do, which I think really separates us from a lot of other vascular providers, and it's a different mindset where we can really collaboratively take care of the patient together. So half of our space is dedicated to minimally invasive procedures. We have a separate pre-op holding area, and behind us is a separate post-recovery area. both are staffed with their own nursing staff, and it allows for patient privacy, patient comfort, and patient safety. Also associated with this portion of the facility is our procedure room. So our procedure room has a space for anesthesia. So we have a separate anesthesia provider who can come in and provide higher level of sedation for patients who need it. The equipment is brand new, state of the art. We just purchased it. It was delivered last month, including fluoroscopy units, machines for venous insufficiency treatments, radiofrequency ablation, as well as different types of sclerotherapy. And as far as critical limb ischemia goes, multiple atherectomy devices, pretty much available, any of them that are available. The highest level of stents, drug-eluting stents, new stent technology, drug-coating balloon technology. Anything that's being used in critical limb ischemia, we're using here. We also have had quite a history of clinical research with new devices. Both Dr. Petruzzi and I have been involved in multiple device development and research in patients to see how they end up working in the long run. The procedures that we perform here. So we love to do critical limb ischemia, diabetic foot ulcers, non-healing ulcerations, rest pain, patients with claudication. All minimally invasive, all same day, in and out. That's also with the peripheral arterial disease. Also goes peripheral venous disease. Patients with venous ulcerations, painful varicose veins, they can all be treated here, and they're treated here very commonly. Uterine artery embolizations for fibroids. There's kyphoplasties for compression fractures. These are all things that we can do, and we do very commonly, same day procedures here, minimally invasive. We do all types of venous access, PICC lines, dialysis catheters, chest ports for chemotherapy, dialysis access, so if someone's dialysis access clots, they need a declot. These are things that we do with urgent add-ons, same day for the most part. We're also capable of doing drainage type procedures for people who have infections or other things that need drainage catheters, whether it's in their soft tissues or kidneys or basically anywhere. And a full range of biopsies. So we do a lot of biopsies. Again, they're very quick and easy to do. And when they come here, biopsy basically takes a few minutes in and out, and there's not a lot of the hoops to jump through, kind of as you go to the hospital. We can spend a whole day to get a biopsy done, going through admissions and the different nursing questionnaires, stuff like that you have to fill out in the hospital. We do things very streamlined here. So there's a bunch of kind of new things that we're still trying to do as far as embolizations, prostate embolizations is a new thing we've been doing the past year or so for benign prostatic hypertrophy, great results. And there are other things that we'll continue to develop and continue to do. Other embolizations for uterine adenomyosis or for hemarthrosis, so bleeding into a knee replacement. We can embolize that. There's a lot of more fun things that we're doing here that we hope to continue to grow, and we have the space to do it. So there's our tour. I want you to call us basically for any patients, for any consultation you need. We're looking to be consulting physicians, not necessarily looking just to get procedures done. So as I showed you, the consultation area where we spend most of our time, or the procedural area, which is just here behind me, we have the full service, full space to help take care of your patients the way they're supposed to be taken care of. We can provide transportation if the patients can't get out, they don't have a ride. That's something we're happy to do for them, whether that's for a consultation, ultrasound procedure, or a follow-up. So between Dr. Petruzzi and I, and Dr. Kim, Dr. Patel, and Dr. Schmidling, you're not going to find anybody with the experience that we have, the unique skill sets to treat these patients. Both Dr. Petruzzi and I regularly speak in regional, national, and even international conferences about critical limb ischemia. We've contributed to the literature. We've written the research papers. We're experts, kind of on call to be asked about any of these procedures. So we're happy to give that expertise to you, and hopefully, you can reach out to us via the website, via our phone numbers. Give us a call. We'll get back to you immediately. The communication is thorough and it's rapid, and we pride ourselves on that. So I hope you enjoyed the tour, and hope to hear from you soon.